let's see. So hand washing. I know you guys probably think, why are we learning about hand washing?
Considering we learned that in like the 3rd grade.
We didn't learn it this way. But I will tell you this, real life experience here. When I was in nursing school, our very first test was hand washing, and it was a skills check. It was either make a 100 or get kicked out of nursing school. That was it. That was like first week of school. I mean, those were the 2 options. They taught you the hand washing procedure, the correct procedure, and then you either do that or you fail and you don't come back. So hand washing is really important, not just for nursing school, but just for us as far as getting sick and taking care of ourselves. So So especially for any kind of healthcare, occupation in any area of not just nurses and doctors or therapists or whatever, but any area, even in the, even in the business office, it's important because you think about even the papers, they've gone to the patient's room, the nurses have handled them and written on them, doctors written on them, and then they come back to you to file. They still have germs living on them. Like, it's still important doesn't matter where you are. And it's good for anybody, whether you go into healthcare or not. Hand washing is the best way, the most effective way to prevent getting some kind of infection, or getting some kind of illness. So a lot of these pertain specifically to healthcare, but some of them pertain to other things too. So you always need to make sure you wash your hands before and after every patient contact. If you've ever been in the hospital, you should notice, okay? You go in, the nurse should grab some hand sanitizer when they walk in, get some more when they leave the room. That should just be, and normally it just kind of becomes routine. And a lot of them have like that, kind of like the spray kind or whatever. They should, every single time they walk in the room, they need to wash their hands. If they don't, then ask them, did you wash your hands before you came in here? It's not gonna, you need to take care of yourself, and that's one way to do that is to make sure everybody else is doing their job too. Anytime your hands become contaminated, obviously if your hands have been exposed to something before you put on gloves, right? And you think, hey, if I'm wearing gloves, why not also need to wash your hands? But you never know when a glove is going to rip or when it might get punctured and something might get through it, so you need to wash your hands afterwards. The same thing, you always wash your hands even before and after you put on gloves. Before and after handling specimens, that's talking about like you've got blood tubes or a urine specimen or something like that. You want to wash your hands because you don't know what's on the outside of that, even though the blood's on the inside. If you're not sure, you're just like, well, I remember when the last one was I washed my hands. Just wash your hands. It's the safest thing to do. After contact with any soiled or contaminated items, so let's say I'm changing somebody's sheets, definitely want to wash my hands after I touch something of theirs. Picking up something off the floor, any bathroom use, obviously, we know that we want to do that before we use the bathroom. You cough, sneeze, or use tissue before and after contact with your mouth or like a mucous membrane. Your mucous membranes are kind of like the wet membranes of your skin. So you think about the inside of your mouth, it's considered a mucous membrane. Your nose, your eyes, all those are considered mucous membranes. So if you want to eat, drink, obviously put anything on those areas. Putting in contacts, you make sure your hands are really clean before you change your contacts. Because eyes are a big way we get infection, not just eye infection, but other germs can make their way into our system that way. And so soap is what we use, right, to get rid of germs on our hands. And the purpose of soap, if it's not antimicrobial, which a lot of soap isn't, right, that is really just to wash away germs. So the whole purpose in you washing your hands is for you to get your hands wet and you get a really good lather. And then you use that lather, lots of friction, right, and gets those germs loose off of your hands, and then you rinse them off. So if you go into You know, if you go somewhere where they only have cold water, what happens with cold water? What happens when you try to wash your hands with cold water? Why is that? You're okay, you're on the right track. What'd you say? What happens? Are you able to, what happens to your lather when you use cold water? It's just really hard, right? Like, you know, if you use cold water and you've got soap and you try to rub it together, it usually just like, it just won't ever kind of get sudsy. You know, it just doesn't lather very good. And that's what really gets rid of the germs, is that lathering it up and rinsing it off. So warm water is always best. There are some soaps, you know, that like antimicrobial soaps, they also work to kill germs, but normal soap doesn't do that. So that's why you have to wash them really good with that. Liquid soap is better than bar soap. Bar soap can actually like carry germs on it. Sometimes you go to a gas station or something, all they have is bar soap. Always grosses me out. I always just take it and like rinse off the outside of it before I ever use it. And then I make sure I've got, you know, a good amount of soap to wash it away with. And then hands should be washed for 10 to 15 seconds. We'll talk about the procedure here in a few minutes. If they're heavily soiled, then you need to wash them for a minute. So if you can see stuff on them, you know, you need to wash them for at least a minute. And I usually say 10 to 20 seconds, so that you may see that on the test. You know, that this is what our curriculum recommends, but I've learned before up to 20 seconds. Okay, it says use friction to help rub off the pathogens, so make sure your hands are washed really good. All surfaces of your hands need to be washed, right? Backs, in between your fingers, wrists, all of that stuff. And the fingertips should be pointed downwards. Why do you think that's important?
So the water doesn't go.
Yeah, so water doesn't go. Think about it. Water drips back up your arm, up here where you didn't wash, and then you put your arms back down and it drips back down to your hand. What have you done?
Yeah, dirty.
Yeah, you got all the germs that were up on your arm back down to your hands that you just washed. Dry paper towels should be used to turn the faucet on and off. Why dry?
Because if it's wet, it'll put germs on the water, and then it'll put water on you.
Right, so, you know, a lot of us probably use a paper towel to turn the water back off, right? But if that paper towel is wet, to turn it back off, the germs just travel right back through that wet paper towel. So always make sure they're dry. Okay, let's talk about hand sanitizer for a second. So, I went backwards now. So hand sanitizer, it says when hands are visibly dirty, or if they're, you know, they're contaminated, so you got something on, maybe you've got blood on them or something else on them that's really gross, then you need to use soap and water to wash them. You can see dirt on them. If they're not visibly soiled, you can use like an alcohol-based hand sanitizer. They more often use the hand sanitizer, and there's reasons that it benefits. One thing though is after you've used hand sanitizer for like several times in a row, if you've ever done that, it like makes these little peelies, like this little, I don't even know, like a little film or something on your hands. So it's time to wash them if you get that far along with your hand sanitizer. But hand sanitizer works because it actually kills the germs. It's not like soap that just washes them away. Hand sanitizer actually kills the germs. That's what it's supposed to do because of the alcohol in it. The waterless says it provides several advantages. But again, if your hands are visibly dirty, if you can see something on them, then you need to wash them with soap and water. So some of the things that make hand sanitizer better: less time. Right? It doesn't take as much time. You think if you wash your hands correctly, it's going to take about 30 seconds or longer. Versus hand sanitizer, you know, you put it on, rub it in, and you're done. It's acts quickly to kill microorganisms. So again, it kills them instead of just washes them away. It's more accessible, right? And keeps them in your pocket or your purse, it's on the walls, wherever. Reduce bacterial count on the hands. It doesn't promote resistance because it actually kills the germs. And then it's less irritating to skin. It's usually not so, it doesn't dry your skin out, the same way that soap and water does. So 4 steps using hand sanitizer. You need to know how to use it correctly. Make sure, again, there's nothing visibly dirty on your hands. Apply dime-sized amount, it says, and then rub your hands together. So still friction, not necessarily friction the same way like washing your hands, but still you make sure you cover all the surfaces of your hands, backs of your hands, wrists, in between your fingers, all those areas. And you keep rubbing it in until it's all absorbed and gone. Okay? It's not, you don't wave your hands and try to dry them out with hand sanitizer on there. You don't rub them on your pants, dry them off, but you keep rubbing until it's all dried up. And it doesn't take long to dry up. It's that alcohol in it. Just a second. That is that. We're going to do, any questions on that? Quick. Something else. Okay.